Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
The county's effort to deal with the opioid crisis tonight on Behind the Headlines. I'm Eric Barnes, publisher of the Memphis Daily News. Thanks for joining us. I am joined tonight by Mayor Mark Luttrell from Shelby County. Thank you for being here again.
Thank you, Eric.
Along with Dr. Alisa Haushalter from the Shelby County Department of Health. Thank you for being here.
Oh, good evening, and thank you for having us.
So I will start with you, Doctor. We talked a little bit before, but let's just do, and you chime in as well, Mr. Mayor, is where it seems appropriate, of first defining the problem from a county, a regional, the regional scale of the problem. I mean, there's more and more attention nationally on this, on the overdose deaths, excuse me. There's more attention. President Trump had a task force on it. The state announced some things recently, which we'll talk about. But from a Shelby County point of view, how many people are using opioids dangerously? How many people are overdosing? How many people are dying?
We don't know the exact number of people who are using opioids, because clearly there's a large number of people that will be using and may not suffer an overdose and may not experience a death. What we do know is that last year alone, we had over 900 visits to the emergency room for overdoses. And those were ones that actually had to go into the emergency room and receive treatment. And then over a 4-year period, I want to make sure I get my numbers exactly right, we had over 500 people that died as a result of opioid overdoses, which is a significant number. What our bigger concern is, if we don't act now, those numbers will continue to go up, and we anticipate by 2020 that a minimum of 250 people would die just in 1 year if we didn't act now. And
we've got a chart from your office, I believe, that shows the trend line of where we were and where we were potentially going without some sort of intervention. How did this start? For people who aren't as familiar with the national crisis, and it is truly a national crisis, I think it's an epidemic by the definition of your profession.
It's definitely an epidemic.
How did it start?
Well, what we know is in the United States, there's actually been a long history of opiate addiction that dates really back to the Civil War. But in more recent years, what's happened is pharmaceutical companies have produced synthetic opioids that were primarily used to treat people with serious pain. And then at the national level, there was a focus on assuring that people's pain was well managed. So what happened is there was a large influx of synthetic opioids through the pharmaceutical industry into the healthcare industry.
And this is what we think of as OxyContin or Percocet, or you might get your wisdom teeth out, or you might have knee surgery.
Exactly.
Those kinds of drugs, right?
Right, and so that was really added into the population, and it just grew exponentially from there over a period of at least a decade, but in some cases, some communities, it's been 2 decades. And unfortunately, then there became illicit business associated with that, either theft of drugs, trading of drugs, sale of drugs, but then there also became black market manufacturing of opioids, which is added to the problem as well.
Yeah, and for a bunch more questions, we'll come back to that.
Sure.
But from point of view, your point of view, Mr. Mayor, the cost associated with this and the problem, your perspective on it.
Well, certainly the cost is significant, but Eric, I've emphasized that the cost is not the driving factor in what we're about. The paradox of this particular problem is it's both a health problem and a safety problem. So we need to look at this, number one, as being a significant public health challenge for us, but also there's very much potential for some illegal activities that are taking place, as Dr. Haushalter has emphasized. So one of my roles is to ensure that we are indeed looking at this epidemic from both sides. How can we ensure that our citizens in Shelby County are well informed and well treated? And then how can we hold people accountable that are responsible for really perpetuating this particular problem? The cost is significant. We know just from the standpoint of what we are undertaking and what the governor is recommending at the state level is significant money. The governor's talking about $30 million at his level. At our level, we're talking about in excess of $1 million to do what needs to be done. So it's expensive from the standpoint of the cost of really addressing it, but certainly the human cost is significant.
The $1 million would go towards, is that prevention, treatment, is it law enforcement, or some combination?
Much of our effort will be focused on prevention, with certainly the side effects of how we can refer people and get them into the right treatment. There are partners that are working with us. University of Tennessee is working with us, and other entities in the local community that are also approaching this from the standpoint of treatment in some cases and prevention in others, and then of course law enforcement in others. So it's being approached by several different organizations and entities across Shelby County, but we do know that the cost will be significant in all of those combined.
And this is an area where there's the Shelby County Health Department. There is no Memphis kind of companion department, and the individual municipalities, we were talking a little bit before the show, don't have their own health departments in Bartlett.
Shelby County, the public health of the community is within the responsibility of the purview of Shelby County government. And Dr. Haushalter was brought in some 2 years ago because of her record of community engagement in the Davidson County health system. And she is our point person for really taking our initiative here in Shelby County from the standpoint of public health. Certainly from the standpoint of public safety, that will be a byproduct of our research and our work. But certainly the public health, informing our citizens, is a primary responsibility of the health department.
I want to come back to some of the law enforcement side and so on, and especially given your background, but I'll switch back to you, Doctor. I remember seeing, it was an employee-oriented kind of presentation. I must have been 5, 6, 7 years ago, and the person speaking was talking about drugs in the workplace, and that was the first time for me that I heard about this opioid problem. And he talked about, I was vaguely aware of it, but I didn't understand the scale of it and the way in which it was growing. And he talked about how people were commonly, given a prescription for, again, knee surgery or wisdom teeth or some kind of routine thing, and they would get 30 pills and 2 or 3 refills. And so he did this basic math of, you've got 90 pills. Most people, when they take again, I'm using the brand names, but an OxyContin or a Percocet or something, most people might take 5, 6, 7 of them. A lot of people don't like them. The side effects they don't like. And so then all those drugs sit in people's drawers and are then basically this oversupply of opioids. And that dynamic, in real simple terms, and I'm curious if that jives with with your take on how this happened, that then kids start taking it because they go through their parents' medicine cabinets, or people coming in and out of the house, a plumber or a cleaning person or whatever. Is that part of what happened? I mean, just this incredible availability of unused, untaken, legally gotten opioids.
That is part of the problem, and particularly at young people. For young people, what we know is frequently they took their first opioids out of somebody's medicine cabinet. They accessed those either in their house, grandparents' house, or a friend's, family member's medicine cabinet. So that actually contributes to particularly adolescents having access. We also know with the opioids that people can become addicted very quickly. So some of the initial thinking around the synthetic opiates was that people could take them and not become addicted. What we know now is that you really want people to have a very limited prescription. That's part of the state focus, is to really work with physicians and other healthcare providers to limit the prescriptions that are given, and also to use alternate ways to manage pain. An example would be dental procedures. I've had people tell me that they or their children received OxyContin for a dental procedure when in fact ibuprofen may have been appropriate or could have been successfully used to treat the pain. So that's part of the statewide campaign, and we'll reinforce those messages locally as well.
Did we say this already? Opioids versus opiates. I know we talked about it before.
Yes.
Help me, because I use them interchangeably,
yes.
I think.
So an opiate is something that's naturally occurring.
So morphine or heroin.
That really comes from poppies.
Okay.
The plant. Opioids are those things that are manufactured chemically to be similar to the natural product, and those would be things like fentanyl that we hear a lot about, OxyContin, which we hear a lot about, but also Percocet and some of those other pain medications.
And again, I mean, as a parent, this all got on my radar. I'm lucky and fortunate my kids never got involved with this, but they certainly have friends and friends of friends who have. A number of things about that. One, it's one of these epidemics that is broad-based. I mean, race, income, class, background, and we have some maps, I think, that show the concentration of where opioid overdoses are happening in the county. The darker colors are more, but they're really in much any area where there aren't quite a few overdoses. Comment on that widespread, that you are not immune to it in any sense by class, race, gender,
or
location.
age.
Or age, thank you.
Or profession. It's all of those.
Yeah.
There's really not any part of our county that's not impacted. Where you see it darker in the center is actually because we have more population in that particular area. But if you think about it, all of us go to healthcare providers, all of us receive prescriptions, and everyone has access, so that this really is a widespread problem impacting really everyone within our community.
Going back to the state, Governor Haslam came forward with proposals, some of which he can do by executive order, some of which are part of a package that will go through the legislature, and as Mayor Luttrell mentioned, the $30 million. One part, and I don't think I have it written down in front of me, was, oh no, I do, to limit initial prescriptions to 5 days.
Yes.
So back to what I talked about, that 30, a standard prescription of 30 with a couple of refills is a total of 90. Again, most people don't take them all, and so you have this huge supply out there, potential supply. 5 days would be a handful of pills? I mean, what would that be from a doctor's point of view? What does that mean?
5 days means enough pills to take them as prescribed for 5 days. So some pills really are not taken that frequently.
Okay.
So that may be 1 or 2. Others are taken every 4 to 6 hours. So it would really depend on what the actual medication is, but to limit the number of days so that there are not extras. And then we really encourage people to count how many they have, to keep them locked away. And if you put them in a medicine cabinet, it needs to be a place that's locked where there's not access. But also when you're done with the prescription, actually to dispose of it. And you can do that at a drop box. Many of the pharmacies have a drop box where it can be left off. And now there's actually, it's a bag that has charcoal in it that can be given at the time of the prescription so that a person can destroy the drugs when they're finished with the prescription. So that way, when you're done with it, you shouldn't have any left over in your medicine cabinet.
From a treatment point of view, it is no small thing to help people with the treatment on this, right? I mean, of all the drugs people might get addicted to, I don't know where it ranks, but it's bad. I see.
Treatment is difficult. Addiction is difficult for anyone. I think the key point is that treatment is available and people can successfully complete treatment, go back to work, live a full life. There are a lot more options than there were many years ago. People can go inpatient, they can have outpatient treatment, they can have faith-based treatment, but there are also medications that can be used to assist a person to manage their withdrawal.
Last question before I go back to the mayor. There's a drug, and I can't remember the name of it. Naloxone?
Yes.
That is to help prevent overdoses, is that correct?
That's to treat an overdose. When someone has been overdosed or experiences an overdose, that actually counteracts the opioid so that they can survive.
And that part of what Haslam's plan is to provide every Tennessee state trooper with this drug in case they've come upon someone or they've responded to a call. Is that correct? Is that part of, would you look to do that at the county level with the sheriff's office or recommend that to the Memphis, have control of the Memphis Police Department, but is that something you'd recommend on a local level?
Yes, and it's actually being used at the local level now, so it's just a matter of expanding it, and certainly we're very supportive of that as we have been in the past.
Yeah, from staying with law enforcement, before you were county mayor, you were sheriff for 8 years, is that correct? Before that you ran corrections. Your perspective from a law enforcement point of view, can law enforcement solve this?
Not alone, no, but no stretch of the imagination. It is indeed a health and a safety issue. It's what we really call the intersection of public health and public safety. I would like to just for a moment outline what the county's strategy is, because we're approaching this really from about 4 different directions. Number one, Dr. Haushalter is the head of our health department. we've asked Dr. Haushalter to assume responsibility for how can we inform and how can we point our citizens in Shelby County in the right direction of how to deal with this if it's a problem with them, and certainly from the standpoint of prevention, how to avoid it. We've asked within county government, we've asked our Human Resources Office to assume some responsibility of educating our staff in Shelby County government, and we've already started an initiative to train all of our supervisors. We had our first class just this past week with in excess of 100 of our supervisors that are going through training, and we have about 500 supervisors that will be receiving this training of how to identify and deal with it in the workplace.
So that would be supervisors, and not just law enforcement, not just health department,
That's
any form or
anyone in
area.
the supervisory capacity who supervises subordinates in their program. And then our third objective, our third attempt is through litigation, if we choose to go the litigation route, and chances are pretty good that we will. Litigation will be headed up by our county attorney. And looking at the options there. That's a very complicated area in the area of litigation, because who do we pursue? Do we pursue the manufacturer, the distributor, the doctors, the pharmacies, the pill mills? There's so many different aspects to the litigation front that that's going to be legally a very touchy area. Do we pursue it in federal court, or do we pursue it in state court? Do we partner with the state, or do we go solo on our own? So there's a lot that goes into the litigation part of it, and that's also part of the law enforcement side of it as well.
To the litigation, I believe it was last week we had County Commission, Chairman of the County Commission, Heidi Schaefer, was on. She is very adamant about going after pharmaceutical manufacturers and wants the county to do so. You referenced that as a possibility. Is your office and the county commissioner, will you be aligned? Will you be moving in lockstep, or is it possible that the county commission will be moving on one path and the mayor's office, the administration on
Well,
another?
we've invited the county commission to partner with us as we're going forward. County commission has set up a task force, and Dr. Haushalter is involved with the task force, as well as other people in the administration. As we make a decision regarding litigation, we'd love to have the county commission's engagement in that as well. But I do want to say that the litigation has to be approached in a very delicate way to determine what's the best way to approach it and who is the best group to go after. Do we go after the manufacturers, or do we go after the distributors? There's a very strong discussion in both areas there. So there's a lot of questions that have to be answered, but litigation is a very real possibility for us.
Roughly 10 minutes left. Staying on the litigation thing, is it a possibility that you would, not simply, but you would join other interested parties?
Yes, very,
other
very
counties,
much.
maybe the state,
We have been in contact with the State Attorney General's office to see what they're doing, the direction that they're going. I've been personally in touch with the Attorney General. We're talking with various other counties across the United States. Many of the law firms that we're talking about are law firms that are dealing with numerous counties. So yes, this is something where really working with others is a force multiplier. So we want to try to find out what's the best approach to take, and that's in large part the collaborative effort of those three entities, our public health, our public safety, and our litigation fronts, to give me the advice that we need to make that decision.
So many questions. Let me come back to heroin. Again, we sort of alluded to this, but what I've read nationally and seen nationally on news reports, there's been this rise in the use of heroin because, and you will correct me where I'm getting this messed up, opioids are expensive. So if somebody gets their hands on a pharmaceutical prescription and they sell them one by one, they get very expensive. If somebody gets addicted to them, they may end up turning to heroin, which on the street is a whole lot cheaper.
Yes.
That dynamic is playing out in Shelby County as well.
Yes, and when we're really kind of targeting prescribers to reduce the number of prescriptions, there actually then is less prescriptions available on the market as well. So then people will go to the alternate, which is heroin, which is much cheaper.
But far more dangerous, or just dangerous?
They're both dangerous.
They're both
And the
dangerous.
combination of both of those together oftentimes is even more dangerous. When we look at the overdose deaths, frequently there's a mixture of drugs that people have used, not just one necessarily.
What is it? Fentanyl? Am I saying that right? What is fentanyl?
It's a synthetic opiate as well. So it's an opioid that was historically used for very advanced chronic pain, but now what's happening is it's actually being made in the black market. And so it's being brought in from other places and sold on the street.
I mean, back when you were running the sheriff's department and you were worried about heroin, or I mean, you were worried about all kinds of illegal drugs. I mean, who's bringing these drugs in? How does the sheriff's? I mean, back in the day, I guess. I mean, because I don't mean to put you on the spot about law enforcement now, but I'm just so curious about how you try to target the people selling these illegal drugs and what can really be done when it gets so widespread.
Well, you're focusing on something that's a very interesting subject in itself, is that what we were dealing with back in the day, 5 to 10 years ago, was a totally different dynamic from what we're dealing with today. Because in many ways, these pills are being distributed in legal ways. It's how they're being used and prescribed and handled by the patient. So it's a different dynamic that we're dealing with opioids than we were from the street drugs of cocaine and heroin and marijuana.
Meth
and those
and
types
all
of things.
that, crack cocaine and all that.
Those were the substances that were transported from the south of the border in numerous ways, that were brought in through the mules that was their profession to bring it in. Here it's much more sophisticated. Yeah. That's why I say that the solution to this problem is not easy, and it's very, very difficult to navigate it. That's why we take our time, we plot our strategy, we make sure that we have the right people engaged that can help us devise that strategy, because it's much different today than it was 5 years ago or 10 years ago when I was in the sheriff's office.
If I could just add to that, I think one of the critical things that has to happen is really partnership. Public health and law enforcement working together, local government working with state government. So an example will be state government monitors prescribing patterns. So it's not that we're ignoring that. We already know the state is doing that, and will share that information with us. We can
legal prescriptions from doctors and nurses.
Yes, to be able to identify where there might be a pill mill or someone who might be. Go ahead.
Define pill mill, because the mayor mentioned that too, and I think that's something that people may not understand.
That's essentially a practice that's run by somebody who has the ability to prescribe.
A legally licensed individual.
Yes, but they are either selling prescriptions or over-prescribing knowingly, and those individuals are targeted by the state. There's data that's collected on a regular basis, so that part is monitored. There's also something that we're looking at obtaining locally called ODMAP, which is a software system that allows anybody who responds to an overdose, so a police officer, sheriff's deputy, EMS, to put it in an app on their phone. And at the health department, we can actually monitor daily where overdoses are happening. If you look at where the overdoses occur in public health, you work with law enforcement to see where the sales are coming from so that you can intervene for sales. So there's actually technology that can assist us, and the partnership and data sharing is going to be critical for us to really address the sales.
Eric, one of the things that we're really trying to focus on is precisely what you're doing today, and that's to educate the public on what is going on, because we're finding so few people really comprehend the magnitude of this problem and how it came about and what is being done to address it. We are already starting to see some fruits of our work. We're starting to see doctors a little bit more cautious about how they're prescribing. We're watching the pharmacies that are being very careful about advising when prescribing. So we're already starting to see some movement, but it's vitally important through any number of mechanisms within our community that we educate the public on the ramifications of this.
You may have mentioned, I apologize, the schools. What are you doing within the schools in terms of education and prevention?
We'll do outreach to the schools. That's not necessarily the first on our list, but we'll work with the schools.
Well, and I don't mean this as a challenge. Why not? What is first on the list?
Really broadly getting the message out to the community at large, which includes young people as well, but we also know there are other organizations that work with the schools directly, so we want to make sure we know what all they're doing and that we provide support to them rather than everyone trying to rush in and do duplicate work. So we have a local prevention council, and part of what they do is work with youth and adolescents, so we'll be partnering with them as well.
Just a couple minutes left, so there'll be a lot we won't get to, but I think you're not saying, but I just want to make sure. I mean, you're not saying these things, these opioids are bad for everyone or should be banned, or are you? Are you saying, look, these should be just go away? It's not the benefit they may give some people aren't worth the overall public health damage.
No, it's like any medication. There are legitimate uses for it, and there are individuals who suffer from chronic pain or may have terminal illness that causes pain, and those individuals should have access and should be able to work with their providers to access that particular medication.
This is a question that I don't mean to put you on a bad spot, and so you can punt it to the mayor, and we could do a whole show on this.
Okay.
There is a medical marijuana bill that's been proposed in Tennessee this year. Arkansas has gone to medical marijuana. Some of the people who advocate for that talk about medical marijuana being a really effective substitute for these much more dangerous opioids. What's your take on
So
that?
that's some of the research is showing that medical marijuana may be an alternate for individuals who suffer from chronic pain. In my role, my role is really to look to the elected officials to make a decision on behalf of their constituents.
You're good at your job.
And
I will go to the elected official.
I would say the optimum term that she uses may be effective. I think the science is still imperfect. I will watch for the science and see how it develops and rely very heavily upon healthcare officials to advise us in that area.
To any degree, are you glad that the legislature is at least debating that issue, though, which probably means looking more at science and looking more at research?
I think it's good, and certainly relying heavily on the science. And I think sometimes we lose touch with the fact that we should rely on the scientific evidence in making those decisions, as opposed to making it purely a political decision.
All right. Again, we could do a whole show on that, but we are out of time. Mr. Mayor, thank you for being here.
Thank you, Eric.
Dr. Haushalter, thank you for being here.
Thank you.
Thank you all for joining us. Join us again next week. Good night. Is appropriate of first defining the problem from a county, a regional, the regional scale of the problem. I mean, there's more and more attention nationally on this, on the overdose deaths. Excuse me. There's more attention. President Trump had a task force on it. The state announced some things recently, which we'll talk about. But from a Shelby County point of view, how many people are using opioids dangerously? How many people are overdosing? How many people are dying?
We don't know the exact number of people who are using opioids, because clearly there's a large number of people that will be using and may not suffer an overdose and may not experience a death. What we do know is that last year alone, we had over 900 visits to the emergency room for overdoses. And those were ones that actually had to go into the emergency room and receive treatment. And then over a 4-year period, I want to make sure I get my numbers exactly right, we had over 500.
The cost associated with this and the problem, your perspective on it.
Well, certainly the cost is significant, but Eric, I've emphasized that the cost is not the driving factor in what we're about. The paradox of this particular problem is both a health problem and a safety problem. So we need to look at this, number one, as being a significant public health challenge for us, but also there's very much potential for some illegal activities that are taking place, as Dr. Haushalter has emphasized. So one of my roles is to ensure that we are indeed looking at this epidemic from both sides. How can we ensure that our citizens in Shelby County are well informed and well treated? And then how can we hold people accountable that are responsible for really perpetuating this particular problem? The cost is significant. We know just
people with serious pain. And then at the national level, there was a focus on assuring that people's pain was well managed. So what happened is there was a large influx of synthetic opioids through the pharmaceutical industry into the healthcare industry.
And this is what we think of as OxyContin or Percocet, or you might get your wisdom teeth out, or you might have knee surgery.
Exactly.
Those kinds of drugs, right?
Right, and so that was really added into the population, and it just grew exponentially from there over a period of at least a decade, but in some cases, some communities, it's been 2 decades. And unfortunately, then there became illicit business associated with that, either theft of drugs, trading of drugs, sale sale of drugs, but then there also became black market manufacturing of opioids, which is added to the problem as well.
Yeah, and for a bunch more questions, we'll come back to that.
Sure.
But from point of view, your point of view, Mr. Mayor,
Production funding for Behind the Headlines is made possible in part by the WKNO Production Fund, the WKNO Endowment Fund, and by viewers like you. Thank you.
the county's effort to deal with the opioid crisis, tonight on Behind the Headlines. I'm Eric Barnes, publisher of the Memphis Daily News. Thanks for joining us. I am joined tonight by Mayor Mark Luttrell from Shelby County. Thank you for being here again.
Thank you, Eric.
Along with Dr. Alisa Haushalter from the Shelby County Department of Health. Thank you for being here.
Oh, good evening, and thank you for having us.
So I will start with you, Doctor. We talked a little bit before, but let's just do, and you chime in as well, Mr. Mayor, is where it seems.
People that died as a result of opioid overdoses, which is a significant number. What our bigger concern is if we don't act now, those numbers will continue to go up, and we anticipate by 2020 that a minimum of 250 people would die just in 1 year if we didn't act now.
And we've got a chart from your office, I believe, that shows the trend line of where we were and where we were potentially going without some sort of intervention. How did this start? For people who aren't as familiar with the national crisis, and it is truly a national crisis, I think it's an epidemic by the definition of your profession.
It's definitely an epidemic.
How did it start?
Well, what we know is in the United States, there's actually been a long history of opiate addiction that dates really back to the Civil War. But in more recent years, what's happened is pharmaceutical companies have produced synthetic opioids that were primarily used to treat